Susan Jackson is joining us now. Talk a little bit about another factor that's really important when we think about our health and our wellness. If I can have you just come in just a little bit closer, Susan. We're going to talk about health insurance and a number of different ways that can affect people of all ages. Now, for a lot of us, we get health insurance through our work, through our business, and for those that maybe have recently lost a job or those that are getting ready for retirement, as they're about to maybe lose that health care, what should they be thinking about? What should be those first steps they take?
They have some time. I mean, they qualify for a special enrollment period because really healthcare you can only enroll at certain times. So if you do lose health insurance, you do qualify for a special enrollment period. So at that time, you can get with an independent agent like myself who has access to all of the programs. I'm talking with, Humana, United Healthcare, Priority Health, Blue Cross, and then you can sit down with a buffet of choices. And so that person like myself does a needs analysis and see where you currently are, see what you need. Maybe there's something in the future that you're going to need as far as health care, and we can look for the best plan.
And so when you're considering what is the best plan, what are the needs, you also got to take into effect that costs are continuing to go up for our medical care. So why in that sense is consulting with an expert like you on insurance something that can be really helpful in bringing those costs down?
That's a great question. I mean, there's so many things to consider, and one of them is cost, definitely. The kind of care that you're looking for, the kind of care that you need, the networks, the hospitals, the doctors that you want to continue to see, that's all in the conversation. So it is really important to, just have a one-on-one because there's not a one-size-fits-all. So if you can get with somebody that understands the current products that are out there, because honestly, there's probably 147 in our area. It's good to sit down to do a needs analysis, to be a one-on-one. My consultations are free. My company is Best Health Options. And so we just sit down and have a conversation, and it's not a once and done. They can always call on an independent broker like myself to get advice if something happens, because you really should analyze your health care every year. Every year there's an open enrollment, and every year you really should sit down and analyze. If you're in the best plan, you might be in the best plan, but you might need to change.
Susan Jackson's with us from Best Health Options at the 15th Annual Greater West Bloomfield Health and Wellness Fair at West Bloomfield Town Hall. Come on out. They're here until 2 o'clock to answer all of your questions. Another big factor we think about in our community here, it's a bit of an elder community. It's certainly a bedroom community, and as people get older, maybe they go off of their regular health care and onto Medicare. And that can be a complicated process as well. How do you help people navigate the Medicare system?
What I like to do, I'm an educator, so I give people the tools to make the best decisions for themselves. If they go in understanding what the process is and what the options are, it immediately lowers the anxiety level. So then they can, look at the different programs and say, hey, this one actually works best for me. So we go in at, hand in hand in the product that works best for them. So it's educating and helping people find the best choice for them. And it's usually best on we look at their prescriptions and their doctors and their hospitals. We start there, and then we can have conversations that usually, pour into other areas of health that I can help as well.
And that's what's really important is this insurance affects all of your health entirely. If you don't have the right insurance plan for yourself, it could be a detriment to your health down the road. So all the more reason to consult with someone like you. Susan, if people want to learn more information, what else can they learn from coming out today and having a conversation with you or another healthcare provider like yourself?
Yeah, it's best to understand what your options are when you're getting around 65. You can have those conversations up to 3 months before you turn 65, and there's a lot to consider. I'm in the business, so it's not confusing for me, obviously, but I can really make it so it's not scary, so it's not confusing, and then you can really see, okay, the A, B, or C, which works for me, really. And like I said, a needs analysis is really done, and a cost analysis too. What is this going to cost me? What is this one going to cost me? And I'm someone that can help with that.
Susan, we appreciate your help already today in answering some of these questions. For those of you that want to come out and talk to Susan, you can do so today, 11 a.m. until 2 p.m., West Bloomfield Town Hall. And of course, always more information on the Chamber and these resources on westbloomfieldchamber.com. Susan, thank you so much.
Thanks for having me.